Doula is a Greek word for female slave. Dr. Raphael coined the term when she wrote her dissertation, and then she used it again repeatedly in her book, The Tender Gift, Breastfeeding. She wrote that in 1976 after she finished her doctoral dissertation on cultural breastfeeding practices around the world. So when she had her son, she had a lot of trouble breastfeeding. They had a horrible experience, and she felt very unsupported. When she was talking to an elderly Greek woman about this, the woman was like, "Oh, well, that's a doula." And so that's what led Dr. Dana Raphael into looking into doula care. Well, she collaborated with Dr. Kennel. Dr. Kennel did groundbreaking research specifically focused on the newborn and the benefits that the newborn has when getting immediate skin to skin care, breastfeeding, and rooming in, which is staying with the mom. So this sparked what's called the Baby Friendly Hospital Initiative. So the Baby Friendly Hospital Initiative is based off of the work of Dr. John Kennel. It's good things. However, I would like to point out that those are baby-centered initiatives, not mother-centered initiatives. And what we do as doulas is we focus on mom's transition into motherhood, because every time she has a baby, whether it's a loss at 8 weeks, whether it's term at 42, every time she has a baby, she is transformed. Her family is transformed. Her community is transformed. Everyone is changed by that birth. So I've mentioned that doulas are a big deal and they make a big impact, but let's talk about exactly how. There was a landmark study done in 2013 with a YMCA in North Carolina that had 200 women in the study, but 100 of them chose to have doulas, 100 of them didn't. But they all went through the same prenatal course. So they met regularly, they had prenatal education, they had breastfeeding education, they had the community, they had the network, but half of them also had doula care. And these are the results of that study. 6.2% decreases in low birth weight. The decrease in additional risk or complications related to the baby or the mom was down by almost 10%. That means 1 in 10 women had fewer complications with their birth just because there was someone else in the room. The C-section rate went down by 7.7%. You'll find that a lot of new moms are interested in breastfeeding. They hear about breastfeeding, but even if they don't hear a lot of positive or negative about it, it's still a brand new experience. They've just given birth. Most women are interested in, yeah, I'd like to see how that goes. The immediate skin to skin and that early feeding is correlated with a decrease in the NICU admits, as well as an improvement in the neonatal transition period, which is that first 4 to 8 hours. During that time period, by keeping baby close to mom, and we see these drastic improvements in the neonatal health, but also having that early intimate time between mom and baby has proven time and time again to increase bonding and increase reports of feeling satisfied with the birth experience, which starts out the entire postpartum period. Another tremendous study that was done in 2018 actually assessed doula care across 3 different states, assessing hospitals, specifically Medicaid clients, because they were trying to see if there was an impact specifically on low income moms, because there is this idea that having a doula was a luxury. So this study showed a decrease from 17.79 to 10.4%. So again, we're seeing an almost 8% decrease in the C-section rate. The preterm delivery rate, so early birth, went from 8.72 to 5.37. That's 3 to 4 babies that weren't born early. Then there was a decrease in the readmission, and then a decrease in the postpartum anxiety by almost half. So going from 14 to 6%, and that's saving lives. The 2 main causes of death related to pregnancy, postpartum in Louisiana, cardiac is the first. The second one is mental health. Those are the 2 places where our moms are dying. And those are 2 places that doulas can save lives. We can do a lot of preventative work in the pregnant time. Postpartum is where we have to deal with mom having postpartum anxiety. We have to deal with her having that postpartum stress. Postpartum's a hard time. We're going to spend a whole day just on postpartum. Doulas today are defined by the International Childbirth Education Association, ICEA. So a doula is a trained professional who recognizes that birth is a key life experience. So they're going to support the physical and emotional needs of the mom, as well as information and advocacy. And they're going to provide information in conjunction with her healthcare provider. A doula is meant to advocate, and to advocate means to empower another to use their own voice. All right. If we're speaking up for her, then she's not empowered, she's not being advocated for, she's being talked over. Let's review family centered maternity care. The idea of family centered maternity care, I call it the nest theory because I want you to be thinking natural as nature would have it, how it would go. So, birth is normal and healthy for most women. I'm going to say this now so that I don't have to say it later. I recognize that there are tremendous medical interventions that save lives, and C-sections have saved countless lives. And there are good reasons to induce, and there are good reasons to get an epidural, and there are good reasons to intervene in all kinds of ways. Ideally, in the most perfect world, that's what I'm going to be talking about when I talk about a physiological birth, and the natural birth is what I mean. It's just the body's process. So birth should be healthy and normal for most women. Care has to be individualized and respectful to that woman. And that means respectful to not just herself, but how she presents herself, how she what she believes in, what she chooses to do with the people around her. We have to acknowledge that she has autonomy, and we have to be respectful and adjust our care for her. So if you have a mom who has an allergy to peanuts, you're not going to be bringing peanuts around her. You're going to adjust your care to be individual to your client. Your decision making should always be her decision making. It's always focused on mom, and it should be collaborative. You ideally want her to be asking her doctor, her nurse, her doula, her partner, her family. You want to get everybody who's in her nest involved in making some of those decisions. Now, the ultimate decisions are up to her when it comes to her body, her labor, her baby, right? But when it comes to how we're like, who's going to watch the other kids while she's in labor, or where are we going to go for birth, or how is your partner going to support you, or who do you want in that delivery room, or what is your ideal situation? What is it that you're going to want to hold on to? What are the special things that are going to be your touchstones to make you feel safe and secure? So that decision making needs to be collaborative from the start, because if we can make it into a team effort from the beginning, then it'll be a team effort at the end. And what mom needs is a whole nest of people around to support her. Education should reflect current evidence-based knowledge. Information should be shared freely between the pregnant mom and the healthcare providers. She can ask them to do the handoff at the bedside. A lot of hospitals actually implement that as a requirement so that the mom can hear everything that the nurse is concerned about or not concerned about, or what she's worried about, and open up that communication line. A lot of moms are going to report feeling as though they weren't listened to because they were never asked. They were never asked for their opinion or how they felt, or told that they had options. They were just told what was most convenient for the nurse, which is part of our staff education, is recognizing that the staff has to come out of their day-to-day bubble and recognize that this is a very special day. Even though it's just a Tuesday for you, it's a very special day for them. And it's hard to maintain that this is a special day for you. This is a special day for you. However, doulas can help, because you can make it a special day for mom, and you can help relieve some of that pressure off of the nurse and help everybody on the team have a more magical experience. Another big part of family-centered maternity care, we talked about how it's evidence-based. Well, part of evidence-based practice is keeping mom and baby together, implementing early skin-to-skin contact, initiating feeding as soon as possible. The big proponents of family-centered maternity care, like I said, it's the nest. Mom is at the center. That's who we're focused on. But it's a good idea to get every single person you can involved, because remember, as her doula, you leave. Whereas her family, her partner, her neighbors, her church or community members, whoever's there in her nest is going to be there when you're not. And the point of the doula is to make sure that the postpartum mom is ready to succeed, to achieve whatever postpartum success is for her. In action, this means that mom's going to be able to choose a place to deliver that she feels comfortable, that benefits her. Now, that's not really going to happen in most cases, because insurance is going to limit where you can deliver and then how much liquid cash you have available to spend, etc. Ideally, you work in collaboration with the healthcare provider. So you're not necessarily going to get to know the physician ahead of time, but the mom should let the physician know that she has a doula, she has an advocate, that there's a member of this team. You want to make sure that you know who she wants in her team and when she wants them so that you can help facilitate her wishes. A mom who is using this family-centered maternity care is going to be moving around during labor because we're promoting what's called a physiological birth. The other part of this family-centered maternity care is refusing routine procedures that are not evidence-based. We wouldn't want to break water just because. We wouldn't want to get an epidural just because. I've heard so many stories first-time mom saying, yeah, I got to about 4 centimeters and I got my epidural. And I was like, good for you. And they're like, what? And I was like, yeah, you must have been really hurting and you were like ready to use a new tool. And most of the time I get is like, no, they just offered it. And I was like, okay. And I was like, oh, okay. Interesting. And then the more we dive into their birth experience, there'll be more and more times where things were just done. Things were just done. Things were just done. Knowing what is routine versus knowing what is evidence-based is also a part of your responsibility as a doula. So make sure that outside of just this class that you have a Google alert on doulas mentioned in the news, that you have a Google alert on Google Scholars for doulas mentioned in new papers, that you're keeping up with what is best practice yourself so that you can advocate for best practice. The next thing we're going to cover is going to be doula care as a scope of practice, and we're going to review the do's and don'ts of doula care. So here's the role and practice of a birth doula. Her role and scope of practice is going to include physical support, emotional support, information, and advocacy. So when we talk about physical support, this is probably what most of you guys are talking about when you think of doula care, when you imagine the woman like fanning the heave, like the breathing woman, or like at her backside, squeezing her hips, or in the tub with her. And a doula does do those things. They are physically supporting mom in the birth space. However, that physical support does start before birth. When you as a doula go meet your mom in person for the first time, it's important that you guys create a physical relationship. Of course, ask consent. Don't just go be touching strangers. The second time that you guys interact with your client in person is when you should be practicing these hands-on comfort measures so that the first time your hands are on her is not in the hospital. If you have the time to build rapport with your client, it can make birth really special for you. Now, it's not about you. And that's actually one of our slogans is it's not about me, it's about mom. The way that you interact with her before labor is going to help her when she's actually in labor, especially if you guys do movements and if you get her into rhythms that she can recreate later. So impacting the physical space is going to be more than just touching her. It's going to be alternating positions, offering different positions. If she's got a really hands-on partner, then your job might just be coaching that partner into what position you might get into next and allowing the partner to really do more of the work. Different ways to move, reminding her to use the bathroom, to have a sip of water, and to eat. We often forget to do these things when we're in labor, and the nurses are not going to be actively feeding you. So it's a good thing for the doula to remind mom that she's working hard. And just like if she was running a marathon, she needs to hydrate, she needs to fuel her body, and she needs to go to the bathroom when her bladder's full. The last part of your physical space is going to be your 5 senses. So we've talked about the touch, right? But a doula can also impact mom's other 5 senses. You can impact her smell. You can bring a Glade plug-in or some nice spray, or you can put some essential oil on some toilet paper and she can breathe that in. Some hospitals might have little stickies that can go on mom's gown that smell nice. So you can change her environment and how things smell. You can change her environment and what she sees. You can dim the light. I've seen moms bring TVs and watch a show that can help distract her. What she sees as far as what's on the wall could be really important. If it's a hideous hospital room, she might want to bring in some of her birth art if she did any birth art in preparation for her labor. If she wanted to bring any focus objects. I've seen a lot of religious moms bring in religious statues. I've seen moms who've had fetal loss, who have lost family members, bring in pictures of them. Anything that makes her feel as though she is safe is going to decrease her cortisol levels, which is going to increase the efficacy or the strength, the power of oxytocin, which is going to help progress labor more productively. Anything that helps calm mom down is actually going to scientifically and from an evidence-based perspective improve her birth outcomes and make labor and birth better. So we've done touch, we've done sight, we've done smell. Now let's do hearing. Make a playlist. Listen to the music you listen to at your wedding. Put something on. Listen to rain sounds, but make sure that what she hears is lovely. Because if all she hears is the occasional beep, 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 and the chattering of the nurses, that's going to be really distracting from the important work that she's doing. Plus, things are sacred when we make them sacred. So make her space special. Now let's talk about taste. Bring along some tasty treats. If the mom has any sort of medical intervention, then she is not going to be allowed to eat anything by mouth except maybe a clear liquid diet. How are you going to know what she's allowed to eat, what she's not allowed to eat? You're going to have to ask the nurse. It is important that you establish yourself as a member of the team. And the nurse, she's the quarterback of that team. The doctor's the captain and mom owns the team. The nurse is the quarterback. She's calling the shots as she sees them. She's the one who's there. She's the one who's going to be holding the weight. If anything goes wrong, it's going to fall on her. She'll get yelled at. But the nurse is also there because she went through nursing school, fell in love with mamas having babies, and loves to be here for it. So she might be having an awful day, but you can help remind her why this is so beautiful by making the space beautiful, by making the labor beautiful, by just bringing in those elements that make her feel safe and at home and calm her down. That's going to trickle down through the staff as well. So when you get to the hospital and you're getting mom settled in, make sure you introduce yourself and build a rapport with the nursing staff as well. That's the physical support aspect of doula care. The emotional support aspect, this is where we have empathetic holding, which we talked about earlier, where we're just listening, just quietly listening for the purpose of hearing what they have to say, understanding their perspective, making sure that what support you provide is culturally appropriate. I like the term cultural humility. That's what we're striving for. We are striving to recognize that every single individual person has a unique and special culture that you do not know about, and that it would be an honor and a joy to get to know any part of it. But that is cultural humility. So asking questions like, is it okay if? Or if you're really unsure, then you can say, I noticed that based on how you dress or based on this, and I'm assuming X. And then you can ask further questions. For example, if you have a client who is modestly dressed, you are going to potentially assume, based on the way she's dressed, that she might not want men in the room with her. She's modestly dressed. Perhaps she doesn't want other people to see her body. Birth is a very exposing time, so I'm just putting two and two together. So instead of going up to this person and being like, is that a hijab? Are you Islamic? What's the Muslim faith like? Instead, I would just merely go to the facts and say, I recognize that you are modestly dressed. Are there any parts of your modesty that you would like for me to protect or be very careful of while we're in the hospital? And then leave it open for her. You don't have to ask the right question. You just have to ask a question and then hold the space for her to answer. Because if she has something she wants to share, she will share it. Hold the space. And again, holding the space just means quietly sit there and wait for her to answer. Humans will fill the space. It's a need. We can't help it. Another part of emotional support is reading the room. This is important when you have a lot of big personalities in a birth room. And the thing is, when a woman is giving birth, she should be the main character. However, she's not. Everyone in that room considers themselves the main character. The grandmother, she's about to get her new grandbaby. The baby daddy, he's about to meet his son or his daughter. The best friend, her best friend's giving birth, and she gets, like, everybody gets to be the main character of that story. But the doula gets to come in and gets to be the sidekick. The doula gets to come in and be there for mom. But you still have to navigate all of those different characters in the room. So learning how to come into a space, take a beat, and read the room before you get started. A lot of doulas will be so excited about coming into the birth room, and they'll have an idea of how this mom may or may not want doula care or what they think a doula should provide. And before taking a beat to assess, they just go in. That's not the way to do it. So even if your mom, like let's say you walk into the room and she's laboring on a ball and she's rocking back and forth and you're like, oh, I bet she would love a hip squeeze. We're not going to go into the room and immediately start touching her hips, right? We're going to wait. We're going to look around, read the room, etc. Reading the room is going to also help you support the family, because remember, the family is going to be there when you're not. So if you can give mom hip squeezes and take her pain from a 10 to a 7, that's awesome. But if the partner could give mom hip squeezes, he'll be able to take it from a 10 down to a 3, because that touch from an intimate person is going to release more natural oxytocin. It's going to release adrenaline. It's going to release serotonin, and it's going to have a bigger impact. So get the partner involved. Get the grandmother involved. Labor is not a spectator sport. If you are in that room, you are there to work for mom, because we are all on her team. She's the team owner. So if you're in that room, you're there to work for mom. So get them involved. Also check in on them. Do they need something to drink? Did they need something to eat? Did they want to be in a picture? Because remember, this is a special time for them as well. And there are going to be moments where the mom's got it. She's on it. But grandmother might be losing her mind. And it might be the better space for you to go take care of grandmother so that mom can handle her own business. The doula also gets to be the bad guy in the room. You get to be the one who shoos everyone out because mom wants some privacy. You get to be the one who's like, well, I'm not coming back, so you got to get out of here. The last thing about emotional support is learning how to be okay with just being okay. If the mom has not kicked you out, she wants you there. Remember that. If she has not kicked you out, she wants you there. So if you are just sitting on the couch in her room, just being there, and she's just doing her thing, if she's comfortable and is handling her labor well and feels supported, great. If you feel like you're completely useless, ask mom if you can do something for her. Offer to do certain things for her. But if she just wants you to sit there, then just be okay with that, because you're still there for a reason. You're still empowering her. You're still there in case something goes wrong. You're her safety net. So be okay with just being okay. Nobody starts off as a super doula. Nobody starts off being able to do the best hip squeezes in the world. No doula has a perfect record of like every single mom I've ever supported has gone without an epidural, and they've all been magical vaginal births, and the angels sang and the lights came down from heaven. It was glorious. That's not going to happen. Instead, it's going to be some weird births. There are going to be some uncomfortable moments, but you're going to be there, and that's going to matter. You're going to watch that baby be born, and that's going to be a matter. You're going to witness to that transformation, and that matters. Next is informational support. We need to keep our moms informed, because a lot of us rely on television to be our primary teacher. Television teaches us what to expect during labor. Television teaches us what to expect during postpartum and being a parent. None of it's like that. It's all so much messier and much more complicated. So informing mom about what to actually expect is so important, because every woman that you educate is going to educate their sister or their aunts or their tias or their friends, and that information is going to spread, and we're going to be able to make changes in the state with the worst maternal health outcomes out of any other state, and we're going to be able to make some changes here and now, one mom at a time. And you get to do that by staying up to date on the literature, by coming to your doula class, by learning these things, and then by helping mom find answers herself. So when mom has a problem or has a question, remember, you not having the answer is not a bad thing. It just means that it's an opportunity for both of you to learn. So when mom has a question or has a need that you can't fill, reach out to your network, reach out to the other doulas. Find other resources that can help you. You do not need to be her end all be all. You're there to help her build her nest. And then supporting her partner and family and information as well. If she's got a really involved family member who had babies more than 10 years ago, a lot has changed. If they've had babies more than 20 years ago, everything has changed. So you're going to have to educate the family as well. If you don't have the opportunity to get face-to-face with the family, that means leaving mom with either books, pamphlets, meeting at the library so she can print things out, directing her to free online resources. Make sure that you're giving her support that she can digest. That is her education level. So if you've got a mom who's got a PhD in engineering, that's awesome. she still might not be able to handle the PhD in obstetrics manual on how to give birth. So keep in mind that you're going to need to assess how your mom best learns, what information is going to be needed for her, and how best to deliver it. The last part of doula care is advocacy. And this is probably one of the most important things that you guys can get involved in now is advocating for doula care, because our state has recognized doula care as so important that insurance is now legally required to cover it. Because our profession is growing, we need leaders in the doula profession who are going to advocate for best practice, who are going to advocate, who are going to be on the doula registry board, who are going to speak out for women of color, who are going to speak out for marginalized women, low income women, women on Medicaid, who are going to advocate for every person. So that's a really important part of your job once you are a doula. It's not just advocating for the client you're assigned to. It's important that you make the time to go sit on the Capitol when we're out there advocating for doula reimbursements, and when we're out there advocating for equity for our young moms who don't have health insurance, or they don't have housing, or they don't have education for their young kids, or they're trapped in poverty. So there are so many ways to advocate. And it's important that you, as somebody who is going to be touching such a sacred and special part of humanity as pregnancy, birth, and postpartum and parenting, you get to touch the core of so many foundations. And so it's important that you use that power responsibly and that you advocate. Also advocate for your mom individually. So we've talked about advocating for doulas as a whole, advocating for the profession, but advocate for the individual, advocate for your mom. This is not speaking over her. This is not saying things to the doctor outside of the room and being like, well, her birth plan says this. Advocating for mom is going to be empowering her to say to her doctor herself, this is not what I want. I do not consent. Or this is what I want. I do consent. Because we want mom to be the primary decision maker, because legally she is. So she's just using her own right. So remember, advocacy is not speaking for her. Advocacy is giving her the encouragement and the power to speak for herself. Now let's talk about the limitations. So this is what you do not do. There are 3 main things that you do not do. You do not give medical advice. You are not a medical practitioner. If you are a medical practitioner, when you are wearing your doula hat, you are not. Okay. So when you're wearing your doula hat, you are a doula, and a doula is not a medical professional. So as a doula, you will not be giving her medical advice. However, you can give her information. You can give her factual details, things that you know, but when you get into advice is when you get into personal experience. So if you were to say what I would do, or if I were in your shoes, and the thing is, moms will ask for your medical advice. They'll call you and say, my blood pressure was 180 over 100 and they want to admit me to be induced for preeclampsia and I'm just not sure. If you say, well, I don't think that's a good idea, you're only 37 weeks, that's your opinion, that's advice. If you were to say, what was your blood pressure and why is your physician afraid of that? Do you have everything you need for an induction? Are you set up? Are your kids ready to go at home? How soon can I get there? If you've been experienced in the birth world, then you'll recognize that as an absurdly high blood pressure and you'll say, it sounds like a great idea, I'll be there shortly. The best plan of action is to always assume that the physician has the patient's best in mind. And so as they make decisions and present options for the mom, make sure that you're always under the assumption that they're doing what they truly believe is best for that mom. So then when you present information, you can be objective about it. You can take your personal feelings and opinions out of it because you're just sharing a fact. So when I have a client who has an epidural and the physician comes in at 7 a.m. and wants to break water, let's say she's 6 centimeters dilated, she's doing great, we're moving her around, she's comfortable. And the physician's like, let's go ahead and break water. Well, I would ask the mom, do you want to have your water bag broken? That leaves it up to mom to say yes or no. Likely what'll happen is she's going to start asking questions like, well, do I need to have that done? Or why are we doing that? And the thing is, there's nothing intrinsically wrong with having your bag of waters artificially ruptured, especially if you're at 6 centimeters and you've got an epidural that's working comfortably. It'll speed things along. However, it's unnecessary. And any unnecessary intervention is going to increase the chance of another unnecessary intervention. They're thinking, I'll break her water, she'll progress even faster, I'll get this baby delivered before lunch, everybody's happy, fed, and awesome. And they're right. Everybody would be happy and fed. However, you're putting mom at additional risk. So a lot of times it just takes mom to be like, well, do we need to? And then mom has the power to be like, I don't want to do that right now. Or say like, okay, yeah, let's do it. I'd love to have a baby before lunch. It just needs to be mom's decision. So if everything is healthy and well, it needs to be mom's decision. When things are not healthy and well, we cling to our physician. But when things are going healthy and well, we want to allow them the space to continue that way. Do not give medical advice. If you're asking yourself, is this objective? Is this my opinion? That's how you're going to determine if it's advice versus information. Do not contradict a healthcare provider. That is the fastest way to get yourself kicked out of the labor room. And then how are you going to advocate for mom? It's out of your scope of practice. You are not a medical provider. We can ask questions. We can ask as many questions as we want. It's even better if we encourage mom to ask questions. If mom doesn't ask questions, then when the physicians leave the room and we have a private moment, is there a reason you didn't ask them? Do you want me to write those questions down? Even though you might be riled up, she might not care. Make sure you're always, again, reading the room, assessing what mom wants, not what you want, not what you think is best, but what mom wants and what is objectively best practice. If a healthcare provider is doing something that you think is intrinsically unsafe, then you should go to the charge nurse. If the charge nurse is the person who is doing the thing that is unsafe, then you go to the unit manager. The last thing is you don't perform any medical tasks. So if you're a CNA, a nurse, a physician in your other world, when you're in doula world, you are not a medical provider. You're not starting IVs. You are not recording blood pressure checks. You are not looking inside the patient charts. You can't be accessing those medical records. You cannot perform any medical or clinical tasks, not while you're a doula. As representatives of Mary's Hands Network, you need to make sure that you do not practice outside of your scope. But in addition to practicing as a Mary's Hands Network doula, you have to maintain a level of professionalism and discipline, especially if you are a team leader. Just because the client can't afford to have a doula and is instead using our services doesn't mean they still don't deserve a dedicated and passionate volunteer. I believe and I do hope that every single one of you is on this call because you want to be that dedicated, passionate volunteer for a mom who it's going to make a difference in their life. And every mom deserves this. Keep in mind that there are implications to your practice outside of those 3 things that you can't do in the hospital. As a doula, you're representing an entire profession, and we are growing at an exponential rate, and you guys are going to get to be a part of that early growth. That means that you're going to have influence in this profession. Be aware of your follow-up with your moms. Make sure that you don't let clients drop off or you don't get back in touch with them because your life got too busy. Because if you agree to be on their team, if you agree to serve them in this way during this time, then you are agreeing to love and support them with a level of professionalism and human dignity. As you're working on your teams, if you ever have any questions, you will have a team lead. The team lead is always going to be somebody who has more experience in the group. Also, you're going to need to use your brain. BRAIN stands for benefits, risks, alternatives, intuition, and nothing. When you use your brain, you're going to first think, how does this option benefit? What are the risks to this option? Are there any other alternatives that I could think about or learn more about? And then what does my gut tell me? What does my intuition say about this experience or this opportunity? And then the last one is, what would happen if I chose to do nothing? I like to use the example of, should I have Pitocin? There are lots of different scenarios where the answer could be yes, no, or maybe. In order to determine that situation, I need to use my brain. In what situation will there be benefits to using Pitocin? If the baby's not moving around much, if the baby has growth restriction, if mom has preeclampsia, elevated blood pressure, there are lots of times when using Pitocin for an induction would be great. Now, let's say mom's admitted into labor on her own and the physician wants to use Pitocin because she's just been admitted into labor. Ask yourself, what are the benefits? If there's a medical reason that mom or baby would benefit from having this baby out, or maybe there's a social reason that mom needs the baby out. Maybe mom is 39 weeks, but dad works overseas, and this is going to be the only time that he'd be able to see the baby. Maybe mom's all alone and she has family that's flying in to help her postpartum, so she's going to schedule an induction at 39 weeks so that she can have her family support. So there are a lot of reasons, but we want to make sure that we're asking ourselves, what are the benefits of this? Because we also need to look at the risks. We could be increasing her heart rate and blood pressure. We could negatively impact the baby. We could overstimulate the uterus. We could dehydrate mom. We cause labor dystocias. We could cause baby to get stuck. We could cause uterine rupture, placental abruption. There are all kinds of risk factors, but a lot of times we just think most people get induced and they're totally fine. The reality is they're not. Our birth outcomes wouldn't be as tragic as they are if people were doing just fine. So we have to start looking at what are the risks of our different options more closely. Let's say there are a bunch of real life benefits to being induced. There are still risks for certain methods of induction. There are fewer risks with some methods and more risks with others. Fewer benefits with some and more benefits with another. For example, Pitocin is going to work really fast. Pumping your breast might not work so quickly. Breast pumping, nipple stimulation, even using a different medication, using a manual technique. There are so many different methods of inducing labor before you get to that point. So looking at the alternatives and of course, asking yourself if you're even interested. Because if you're not interested in the alternatives, you don't need to look that hard because that's when your gut comes into play. Trusting your intuition, trust your gut, see what it says. And then ask yourself, what happens if I do nothing? So, for example, if baby's not moving around much and has uterine restriction, so it can't grow, if we don't induce, if we do nothing, well, baby could die. So that might not be a risk that we're willing to gamble with. But sometimes doing nothing is like, let's wait 2 hours. Let's wait 30 minutes. Let's wait 15 minutes. Let's wait through the next contraction. Sometimes just giving time to process, to do nothing can be life-changing. So this is why you guys should always use your brain when making decisions.